In this video, we will discuss about pharmacodynamics and pharmacokinetics. First, we want to know what is pharmacology. Study of drugs name is called pharmacology. In pharmacology, we are having two branches. What are the two branches of pharmacology? Pharmacodynamics and pharmacokinetics. What is pharmacodynamics? What the drugs doing on the body, what the drugs doing on the body. What is pharmacokinetics? That means what the body does do the drugs. Okay, what the body does to do the drugs. So what is the meaning by that? Let's take an example. What the drugs does to the body, what the body does to the drugs. What is the meaning? We will discuss. So now this is the master diagram. This one is the master diagram or key diagram. This is the drugs. Okay, this one is the drug which is taken by oral route. Okay, most common convenient route is the oral route. So most common and convenient route is the oral route. So the drugs is taken to that oral route. Now the drugs is going to inside. Now there is a rule, the drugs will get absorbed. So here the drugs get absorbed. So acidic drugs are absorbed. Acidic drugs are absorbed from acidic medium, that is stomach. Acidic drugs are absorbed from acidic medium, that is stomach, and basic drugs are absorbed from basic medium, that is intestine. So the organ of absorption of different drugs is different. Acidic medium, acidic drugs, basic medium, basic drugs. So drugs is different. Acidic drugs are absorbed from stomach. We know that reason. And basic drugs are absorbed from intestine. After absorption, the drugs reach to bloods. Okay, after absorption, that drugs will reach to blood. So this step is known as absorption. So through acidic medium and basic medium, drugs are absorbed to blood vessels. This process name is called as absorption. It is the movement of the drugs from where to where, from site of administration to still circulation. It is necessary that drugs is always given by oral route. If the drugs is given by intramuscular route or it given by any other route, it is inhalation route, inhalational route. It can be rectal. Okay, it can be rectal route. So from that site of administration, it is ultimately reaching in that circulation. So it is the movement of the drugs from where to where, from site of administration to site of from site of administration till circulation. This portion, okay, this portion is known as absorption. Now the drugs is in the circulation. Now from that circulation, the drugs will move to its site of action. It will move to site of action. If I am taking drugs for migraine, it receptor of the drugs is supposed to be cranial cranial blood vessels. Okay, cranial blood vessels. What is absorption? That movement of drugs from site of administration till circulation. Other route, intramuscular, inhalational and rectal route. Then it reach to circulation. So now the drugs in that circulation, now it reach to circulation. From circulation, the drugs will move to site of action. If I have that migraine, it has its receptor of the drugs is supposed to cranial blood vessels. So migraine means that where that receptor is presented, cranial blood vessels. If I am taking drugs for some intestinal disease like diarrhea, constipation, the receptor is supposed to be an intestine. Okay, then if I'm talking for heart failure, the receptor is supposed to be heart. So whatever is the organ of function, the drugs will move to that organ and shows it mechanism of action. So drugs will move to that site of action. Here only it will do that mechanism of action. So drugs will move to that organ, a particular organ, and shows it mechanism of action. For example, I am taking for migraine. My migraine is treated that work. The drugs worked on my disease. Okay, migraine case we taken medicine, now treated. Now the function of the drugs in the body is over. It treated, so function is over. Now my body want to excrete the drugs. Okay, after curing, that drugs want to excreted from our body. It is not there. Okay, the drugs will remain there forever. So no, okay, that that one not stay that particular place. The drugs will not remain there forever. So drugs will come in the blood again. So after that completed action, mechanism of action, then the drugs will come to blood again, will come blood again. After coming the blood, most of the time drugs excreted in urine, that drugs excreted in urine 99% of the time. Very rarely it is excreted in other forms. So 99% time excreted in the form of urine. Some other forms like feces, saliva and breast milk, but most commonly it is excreted in that form of urine. So drugs is going to kidney and asking, so here function is completed, so it want to excreted in that form of urine. So drugs is going to kidney and asking the kidney to excrete it. So excrete the drugs. But kidney is saying no, I cannot excrete you. Why? Kidney is not excreted the drugs because most of the drugs are non-polar. Only polar drugs only excreted through urine, but most of the drugs are non-polar. What is urine? Urine is water, so only water soluble drugs will be excreted in urine. Water is the what is the water soluble drugs? What is water soluble drugs? Water soluble drugs is polar. So first we have converted non-polar drugs to polar drugs. So kidney is asking the drugs, first you get convert from non-polar to polar, then come back to me, then I will excrete you. So what the drugs is doing? The drugs is going to liver. So again it will go to liver. Can you please converted me from non-polar to polar? My job is over now. I want to get excreted. So liver is saying yes. So liver, now these drugs will go to inside of that liver hepatocytes. So inside hepatocytes there are enzyme is presented, they will converted you from non-polar to polar. So converting the drugs from non-polar to polar, else hydrophobic to hydrophilic, else say lipophilic to lipophobic one. And the same things, water and fat are inversely proportional. So hydrophobic to hydrophilic or lipophilic to lipophobic or else non-polar to polar and the same things. So this steps is known as biotransformation or metabolism. So first step, absorption, the drugs get absorbed and reach to that blood. From blood it is distributed to various organ. These steps is known as distribution, in which it is going to various organ and shows it mechanism of action. Then it is going to liver, showing biotransformation or metabolism. That meaning of which it is converted non-polar to polar, and finally it is excreted out. Okay, excreted out of that kidney. So four things are happening. We summarize what the body is doing on the drugs. First, observing the drugs, taking the drugs from the site of administration to circulation. Then body is distribution the drugs. So the body is distributed the drugs, that is taking the drugs from circulation to various organ. Then the body is metabolizing or biotransforming the drugs, that is converted non-polar to polar. Then the body is excreting the drugs out of that body. So four things the body is doing on the drugs. So this is known as this process name is called pharmacokinetics. What is the body is doing the drugs? Body first absorbed the drugs, then distributed the drugs, then metabolized the drugs, then excreted the drugs. These four things are known as pharmacokinetics. PK having four branches. What is the drugs is doing on the body? Drugs is doing only one things on the body. Drugs is showing its mechanism of action or the site of action. So this portion is known as pharmacodynamics, PD. PD have only one part of that mechanism of action, but PK having four things, that is absorption, distribution, biotransformation and excretion. So here drugs doing only one thing, that mechanism of action. This one name is called as PD, pharmacodynamics. Next, factors which affecting absorptions. See here, the first portion is absorption. What is absorptions? Movement of the drugs from site of administration till circulation. So there are many factors on which it depends on the ultra important factor. Ultra important factors, which is the effect of pH. Okay, effect of pH. So does the pH is affecting the absorption and the excretion. Of course, it is. Imagine you are a doctor, you want to the drugs to be absorbed more in your patient body or excreted more in your patient body. What do you want being a doctor? Imagine there is a patient in front of you, having some disease. So of course you want to treat the disease, you want to absorb more. We want to treat patient means absorb more. But imagine a patient is in poisoning. Patient have taken overdose of the drugs because of suicidal attempt or homicidal or any accidental anythings. Okay, patient have taken 100 tablets together. In that case also you want to absorption? No, only want to treat diseases means absorption is good. We want to that eliminate that poison kind of things. That time we want excretion. We want to save our patient the poisoning. In that case we want excretion. So both are important. We want to treat means absorption is best one. We want to treat, they taken poison, we want to eliminate, we want to excrete the toxin means excretion is important. Both are equally important. We want excretion in the case of poisoning. Depending what we want to say, yes, we can want more depending on the situation, depending on that condition. So depending upon that condition or depending upon that situation, two things are important. We want to treat diseases means this absorption is good. We want to eliminate that toxin, excreted the toxin means that time excretion is the important one. So absorption and excretion both are important ones. Then there are two type of drugs. If the drugs are electrolytes, there are two type of electrolytes. There are two type of drugs. Drugs are electrolytes. There are two type of electrolytes: strong electrolytes and weak electrolytes. Strong electrolyte do not ionize. Weak electrolytes, they do ionization. This one no need ionization. Strong electrolytes means no need for ionization. Weak electrolytes means we need to ionization. pH affects the weak electrolytic drugs. There is no effect of pH on that strong electrolytes. The strong electrolytes are equally absorbed from acidic and basic medium. Strong electrolytes absorbed equally whether acidic or basic medium. But weak electrolytes, the pH is the matter. How does the pH matter? So now we are not talking about strong electrolytes because no need for this strong electrolytes. It equally absorbed acidic and basic medium. We want to only these weak electrolytes only. See this diagram we taken oral route. So the drugs is going inside. So learn the golden rules. Here what is the golden rules? For absorption same pH is required. Acidic medium means acidic drugs, basic medium means basic drugs. So that one is the golden rules. Same pH is required. Learn the golden rules for absorption. The pH, same pH is required. If the drug is acidic, you required acidic medium to absorb. If the drug is basic, you required that basic medium for absorbed. So we knows these rules. So what is the important things here? The drugs is acidic means we need acidic medium. The drugs is basic means we need basic medium. Stomach have acidic medium. You know that intestine have basic medium. That's why acidic drugs are absorbed from acidic medium. That's why basic drugs are absorbed from basic medium. So this is the first rule. Ultimately acidic or basic, the drugs reach the blood. So for absorption we have two different organ. One is stomach and another one is intestine. Now the drugs move to that site of action. Okay, now the drugs move its site of action or already shows its mechanism of action. Move to that liver, already converted from non-polar to polar. Now we want to excrete the drugs from kidney. Organ of excretion is only one, that is kidney. For absorption we have two portions. Okay, one is stomach and intestine. Observation two way, but excretion only one way. We don't have different organ, only one way, only excretion. So acidic drugs are excreted from this organ. Basic drugs also excreted from this organ. Okay, so both acidic, but here observation acidic medium, basic and intestine, but here excretion both acidic as well as basic are excreted through kidney only. In the kidney, the urine is formed. The drugs are excreted in urine, but the pH of urine can be changed. So for excretion, opposite medium is required. So if you want to excrete acidic drugs to make that urine basic, if we want to excrete basic drugs, make the urine acidic. So for excretion, opposite medium is required. So this is the basic rule. Learn basic rule for absorption. Same pH is required. Observation means same pH is required. For excretion, opposite pH is required. For observation purpose, same pH is required. Okay, for that excretion purpose, opposite pH is required. This one is the golden rules. So weakly acidic drugs ionized or excreted move at basic pH. Acidic medium will converted in the form of basic, then excreted in the form of urine. Then basic drugs means it will converted into acidic pH, then it will secreted in the form of urine. So observation same pH is required. Excretion opposite pH is required. What is ionization? This is acidic drugs HA. It can be HCl or it can be HNO3. I mean to say all acid have a protons. Okay, all acids having protons. We know H acid HCl, HNO3, H2SO4. So all the acid having protons, that is H. So it is split into ionized like hydrogen ion positive and A is negative. So where is the drugs here? This one also drugs, this one also drugs. Okay, so where is A? A is our drugs. A is our drugs. H is proton. H is proton. HA will split into H plus and A minus. Where is the drugs? The drugs is presented in two form. HA also, A also. But this one is the negative one. So this HA is known as unionized form. This A is known as ionized form. Here this one is unionized form, so no charge. This one is the ionized form, so here a negative charge. So A is presented in two form. A is presented in two form. Same with the base. Same with the base. There is a base POH. It can be NaOH or KOH. All of the base have a hydroxy ion. It have hydroxy ion. We know the rules. H it split like this one, split into B plus O minus. Here we are interested in this B plus. B is my drugs. So where there is a drugs, here also drugs, here also drugs. Drugs is presented. It is unionized form. This one is the ionized form, but positive charge. It having charge, positive charge. So acidic drugs and basic drugs both are presented in two form. Here also, here acidic drugs also, acidic basic drugs both are presented in the two form. Unionized form also, ionized form also. Unionized is the complete form. This one is the complete form. This POH, this one is the complete, and ionized are splitted version. This one is the splitted version. They are broken. Okay, broken. They are splitted. They are ionized. Now there is the rule of our body. Body don't like broken one. It excreted. Okay, so ionized forms are excreted from the body, and unionized form are absorbed from the body. So this one, okay, unionized one absorbed to our body, that broken one, okay, excreted from our body. So HA and POH, these two things are unionized. The two will be absorbed. These two things will absorb. This one is the broken one. This will be excreted. This one is ionized. So ionized version are excreted and unionized version are absorbed. This is the effect of pH. This is the golden rule of absorption and excretion of drugs. These two things unionized, it will absorb our body. This one is the broken one, splitted one. This one is ionized form, excreted our body. Next, how to acidify urine or how to basify the urine. If you want to acidify the urine, or if you want to, we will give intravenous trips of arginine. Trips of arginine hydrochloride followed by ammonium chloride. Arginine hydrochloride followed by ammonium chloride. So we will give intravenous trips, okay, of intravenous trips. So urine will get acidic to excrete the basic drugs. If we want to basify the urine, give intravenous that sodium bicarbonate. So it is basic medium, so it will basify that urine. So it is this is for excretion of acidic drugs. So you want to excrete acidic drugs, basify the urine. If you want excrete basic drugs, acidify the urine. So acidic drugs means we want to basify the urine. Basic drugs means we want to acidify the drugs. So how to know that which drugs is acidic and basic? there are a lot of list, more than 1,000 drugs is there. So some main drugs for suicide attempt, we should know that list. For emergency, we want to know the drugs name. இந்த வீடியோவில் ஃபார்மாகாலஜியில் 2 branches, Pharmacodynamics and Pharmacokinetics பற்றி பார்த்துருக்கோம். Acidic drugs absorbed by stomach, basic drugs absorbed by that basic medium intestine. அப்புறம் ஆஃப்டர் தட் இது வந்து பிளட்டில் போய் ரீச் ஆகும். அப்புறம் பர்டிகுலர் ஆர்கனுக்கு இது வந்து டிரான்ஸ்மிட் ஆகும். இந்த ப்ராசஸ் நேம் இஸ் கால்ட் அஸ் அப்சார்ப்ஷன் சொல்லி பார்த்துருக்கோம். ஆஃப்டர் தட் பிளட்டில் போயிட்டு பிளட்டுக்கு ரீச் ஆனதுக்கப்புறம் பர்டிகுலர் ஆர்கனுக்கு போகும். ஸோ தட் ப்ராசஸ் நேம் இஸ் கால்ட் அஸ் டிஸ்ட்ரிபியூஷன் சொல்லி பார்த்துருக்கோம். அதுக்கப்புறம் இங்கே ட்ரக்ஸ் வந்து பர்டிகுலர் சைட்டில் போயிட்டு அதோட மெக்கானிசம் ஆஃப் ஆக்ஷனை முடிச்சுட்டு டைரெக்டாக 99% வந்து கிட்னியில் வந்து எஸ்க்ரீட் ஆகும். சம் ட்ரக்ஸ் வந்து நான் போலாராக கண்டிஷனாக இருக்கும். அப்போ வந்து அது வந்து லிவருக்கு போயிட்டு நான் போலார்லேருந்து போலாராக கன்வெர்ட் ஆகிட்டு எகெயின் தட் கிட்னியில் வந்து யூரினாக செக்ரீட் ஆகி வெளியில் ஆகிரும். ஸோ இங்கே வந்து 4 ப்ராசஸ் இருக்குது. ஸோ ட்ரக்ஸ் வந்து அப்சர்வ் ஆகுது, அதுக்கப்புறம் பர்டிகுலர் ஆர்கனுக்கு வந்து டிஸ்ட்ரிபியூட் ஆகுது. அங்கே மெக்கானிசம் ஆஃப் ஆக்ஷன் முடிஞ்சதுக்கப்புறம் வந்து எப்படி வந்து எஸ்க்ரீட் ஆகும்னா கிட்னிக்கு வந்து எஸ்க்ரீட் ஆகும் 99%. ஆனால் வந்து சம் ட்ரக்ஸ் வந்து நான் போலராக இருக்கும், அது வந்து கிட்னி வந்து எஸ்க்ரீட் பண்ணாது. அப்போ அந்த ட்ரக்ஸ் வந்துட்டு லிவருக்கு போயிட்டு நான் போலாரை வந்து போலராக கன்வெர்ட் பண்ணிவிட்டு எகெயின் பிளட் வெசல்ஸ் வந்துட்டு அப்புறம் வந்து எஸ்க்ரீட் ஆகும். ஸோ இது வந்து 4 ஸ்டெப்ஸ் ப்ரெசண்ட் ஆகிருக்கு. எங்கன்னு சொல்லி பார்த்தோன்னா ஃபார்மகோ கைனட்டிக்ஸ் ப்ராசஸில். ஃபார்மகோ டைனாமிக்ஸில் வந்து ஒன்லி 1 ப்ராசஸ், அது வந்து என்னன்னு சொல்லி பார்த்தோன்னா மெக்கானிசம் ஆஃப் ஆக்ஷன் ஒன்லி. ஸோ இது வந்து 4 ப்ராசஸ். வேரியஸ் ஃபேக்டர் வந்து இந்த அப்சர்வேஷன் ஆகிறத இன்ஹிபிட் பண்ணுது. அதில் வந்து அல்ட்ரா இம்பார்ட்டன்ட் ஒன்று வந்து பிஹெச். பிஹெச் வந்து நம்ம ஒரு பேஷண்ட்டுக்கு வந்து ட்ரக்ஸ் வந்து அப்சர்வேஷன் ஆகிறது இன்க்ரீஸ் அமௌண்ட் நடந்ததுன்னா, அதிக அமௌண்ட் நடந்ததுன்னா அது குட்டா அல்லது எஸ்க்ரீட் ஆகுறது நல்லதுன்னு சொல்லி பார்த்தோன்னா ரெண்டுமே குட். நம்ம வந்து எப்பயாவது டிசீஸ்டு கண்டிஷனில் இருக்கிறப்ப ட்ரக்ஸ் எடுக்கிறோன்னா அது வந்து அப்சர்வ் ஆகுறது வந்து குட் ஃபார் தட் பேஷண்ட். அதுவே வந்து அந்த பேஷண்ட் வந்து பாய்சன் ஏதாவது ட்ரக்ஸ் அதிகமாக எடுத்துக்கிட்டாங்க ஃபார் சூசைட் பர்பஸுக்கு, அப்போ வந்து நம்ம வந்து எஸ்க்ரீட் பண்ணணும். அதனால அப்சர்வேஷன் அண்டு எஸ்க்ரீஷன் போத் ஆர் இம்பார்ட்டன்ட். தென் 2 டைப் ஆஃப் ட்ரக்ஸ் இருக்குது. அதில் வந்து 2 டைப் ஆஃப் எலக்ட்ரோலைட்ஸ் இருக்குது, ஸ்ட்ராங் எலக்ட்ரோலைட்ஸ் அண்டு வீக் எலக்ட்ரோலைட்ஸ். இந்த ஸ்ட்ராங் எலக்ட்ரோலைட்ஸ் வந்து அசிட்டிக் மீடியம், பேசிக் மீடியம் எல்லாத்துலேயும் வந்து ஒர்க் ஆகும். அதனால் இதை வந்து கன்சிடர் பண்ண வேண்டியதில்லை. இந்த வீக் எலக்ட்ரோலைட்ஸ் மட்டும் நம்ம பார்க்கணும். இப்போ இந்த ஹெச்ஏங்கிறது அசிட்டிக் ட்ரக்ஸ். ஓகே, இது வந்து ட்ரக்ஸ். ஓகே, இந்த ஹெச்ஏங்கிறது வந்து அயனைஸ்டு ஃபார்ம். இது வந்து ஸ்ப்ளிட் ஆகி திஸ் புரோட்டானாகவும் திஸ் ட்ரக்ஸாகவும் கிடைக்குது. இந்த ஸ்ப்ளிட் ட்ரக்ஸ் ஆகுது, இது வந்து ஈஸியாக எஸ்க்ரீட் ஆகும். ஸோ இது வந்து ட்ரக்ஸ் தான். இந்த ஏவும் ட்ரக்ஸ், இந்த ஏவும் ட்ரக்ஸ். இது வந்து அன்அயனைஸ்டு ஃபார்ம். இது வந்து அப்சர்வேஷனுக்கும் இது வந்து எஸ்க்ரீஷனுக்கும் யூஸ் ஆகுது. ஸோ நம்ம பேஷண்ட் பாய்சன் எடுத்துட்டாங்கன்னா அவங்களோட ட்ரக்ஸ் வந்து அசிட்டிக்காக இருந்ததுன்னா அவங்களோட யூரினை வந்து பேசிக்காக கன்வெர்ட் பண்ணணும். அவங்க வந்து பேசிக் ட்ரக்ஸ் எடுத்துட்டாங்கன்னா அவங்களோட யூரினை வந்து அசிட்டிக்காக வந்து கன்வெர்ட் பண்ணணும். அப்போ தான் வந்து அந்த எஸ்க்ரீஷன் ப்ராசஸ் நடந்து நம்ம அந்த பேஷண்ட்டை வந்து சேவ் பண்ண முடியும். This is all about introduction of pharmacology. pharmacokinetics and pharmacodynamics. Two process, pharmacokinetics and pharmacodynamics. Thanks for watching.